Hello, everybody. I'm Anthony Gonzalez, and I'm the program coordinator for the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. And I'm joined today by my colleague, Logan Davis. And we're very excited to welcome you today to our webinar titled 10 Commonly Asked Questions Regarding the Drug-Free Schools and Campuses Act Requirements, presented by Dr. Eric Davidson. Before we get started with today's session, I do just have a couple of housekeeping slides I'd like to share. Here on the screen should look somewhat familiar as we are in the Zoom webinar format. We do welcome your questions at any time throughout the live session, but we do ask that you utilize the Q&A box. We do have the chat enabled, but please put your specific questions in the Q&A so we don't miss them. We do have live captioning available for today's session, and you can turn that on through your bottom dashboard. If you have any trouble setting that up, please send me a chat and I'll be happy to walk you through that process. We encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. And with that, it is my great pleasure to introduce to you today our presenter, Dr. Eric Davidson. Dr. Davidson serves as the Executive Director for Eastern Illinois University Health and Counseling Services, overseeing the university's medical clinic, counseling clinic, student insurance, and health promotion programs. Since 2009, he has directed the Illinois Higher Education for Alcohol, Other Drugs, and Violence Prevention, overseeing statewide training and professional development for higher education practitioners implementing campus substance use programming. Dr. Davidson is highly regarded for his expertise on the federal drug-free schools and campus regulations and comprehensive substance use prevention programming, and commonly presents at the national level. Thank you for joining us today, and it's my pleasure turning it over to you at this time.
Thank you. Good afternoon, everybody. So excited to be here today. Excited by the good number of folks that are here today. Have a great amount of information to present to you at all. So I am going to go directly into the slide presentation and move forward because the amount of information to provide is very robust. As I developed this presentation, I thought about the 10 most commonly questions that I have been asked regarding the Drug-Free Schools and Campuses Act. And I'm not going to go through all 10 because we will go through the 10 as we go through the presentation. But if you look at the first slide and the second slide, you will get an overview of what those questions commonly are. And they range from: we've never been audited, we don't know anything about this, where do we start, to what are the requirements, what do we do with the biennial review report, what has to be included, how do we do this, where do we begin, and how must it be conducted, and how is it similar to Clary, and how is it different from Clary. So beginning with the questions, one of the questions that I often get is, we've not been compliant with this act. Where do we start? And I always say, begin where you are at. So if you have a completely clean slate, the great news is that we are in what's traditionally considered a biennial review year, which is an even year. The biennial review is typically considered due on December 31st of even years. So if you have not started anything yet, the good news is you've got about 17 days before the end of this calendar year to go back and look at fiscal year 22 and fiscal year 21 and review those years for a biennial period. And develop your comprehensive biennial review for those two calendar fiscal years. If you've done stuff previously, build off of that. What I like to tell people is that there is no such thing as a perfect biennial review. There is no such thing as a perfect comprehensive substance abuse and misuse prevention program. Everybody has some area of growth to build upon of. For those that are new to the drug-free schools and campuses regulation, if you are not familiar with this document that you're seeing on the screen right now, I highly recommend that you become familiar with it. I will send the link to Anthony and Logan so that way it would be available for download. But this is really considered the Bible for the drug-free schools and campus regulation. One of the things that I like to point out is that it is an older document. So people who may go looking for it online may go 2006, there's got to be a newer document than this. And unfortunately, there is not. This is the last document that the Department of Ed has published that provides any guidance. So again, it's 16, 17 years old. It is outdated, but it is the last document that we have. So if you're not familiar with it, if you've not read it, I would encourage you to do so. It's the document that is really supposed to provide the guidance that if an auditor from the Department of Ed were to come to your campus and to be auditing or reviewing your annual notice, your biennial review, or overlooking your comprehensive program, this is the document that they should be using as the foundation of their review. One of the other questions that I often get is, if we are audited, what are the consequences of being non-compliant? Typically, in most cases, if you look at program final review findings, most schools that are non-compliant end up having corrective actions required. A lot of times they have to go back in, they have to fix up components of their annual notification that are missing. If they're not properly distributing their annual notification, they have to do so in a correct manner that meets the requirements of the notice. If they're not doing a biennial review, they have to start doing a biennial review. They have to start collecting data and analyzing that data in an appropriate manner. They just really have to be meeting the requirements of the mandate. Within the last 10 to 15 years, they've also started having to pay financial penalties, which we'll address in another slide. One of the other things that I hear from schools that have been audited, that have been in non-compliance, is that typically an act of non-compliance usually triggers other audits. So if they come for a Title IV audit and they discover a Clery violation, they start looking for other areas to make sure other areas are compliant, which may or may not find other acts of non-compliance, such as Drug-Free Schools and Campuses Act. Typically, if there is an act of non-compliance, that institution's name is given to congressional representatives. There is a possible suspension or limitation of Title IV funding. That doesn't seem to happen a lot, but it is a possibility. And there may also be negative media attention, as well as if there were to be a court matter that comes up, say a student gets injured, a death occurs, perhaps that negative non-compliance could be used against the institution as the institution's indifference to a matter related to AOD issues. As I said, there are the possibilities of fines. Currently, the amount of the fine is just less than $60,000, so it could be up to $60,000. With the Drug-Free Schools and Campuses Act, what we see is that the fines have been increasing over the past few years, and the fines differ from how fines are applied with Clery. With Clery, a school might have a fine for this violation of Clery, and a fine for this violation of Clery, and a fine for this violation of Clery. And if there are 3 violations of Clery, that could result in a fine fee of $180,000. What seems to be happening with the Drug-Free Schools Act is that the fine will be between $0 and $60,000. but it's not the entire brunt of $60,000 times 3. But again, the fine seems to be increasing. Over time, will it end up equalizing as it is with Clary? And if a school ends up having 3 drug-free school violations, could it end up being 3 times 60,000 equating to 180,000? That is possible, but that is not something that we're seeing at this particular point in time. One of the questions that I often get is, how would our Drug-Free Schools and Campuses Act be audited? More often than not, it gets audited when a representative from the Department of Education comes and conducts a full financial aid Title IV program review, or when your Title IV financial aid program applies for recertification. So if you are on your campus and you are overseeing your drug-free campus, Drug-Free Schools and Campuses Act, I always encourage those folks to become best friends with the Director of Financial Aid and make sure that the financial aid folks are letting you know when they're up for recertification and when the Department of Ed folks are coming in for a program review. Because at this point in time, on the checklist of things that the Department of Ed folks are to be reviewing is the Drug-Free Schools and Campuses Act. And a lot of times what I hear from my colleagues, particularly in the prevention field, is that if there's not that relationship, the financial aid folks may overlook it. And then when the Department of Ed folks arrive on campus, they'll be like, oh, we want to hear or see about your drug-free schools. And then a phone call or an email ends up happening. And then at the last minute, someone has to walk across campus with all that information. Audits may also occur as a result of a Clary compliance review. So if Clary is being reviewed, that auditor may look at that. If a complaint is filed with the Department of Ed, that may be enough to trigger an audit. Occasionally, the FBI may do a civil rights audit, so that can trigger it. And there have been some occasions in which the Department of Education have done a media assessment. They just go into Google and look at things like for alcohol poisoning on college campuses and look for different events which may have occurred in higher education to see what unfortunate events or situations may have occurred, and may use that as a trigger to determine whether or not an audit should occur. And they may also just conduct a random audit, but more often than not, it's that Title IV program review or recertification or the Clary compliance review that triggers audits. One of the questions that I often get is, what are the main requirements of the Drug-Free Schools and Campuses Act? And there are really 3 main requirements. And to be in compliance, you have to have all 3. One is that during a 12-month period, your institution has to disseminate a notification of substance use policy and information to all students, staff, and faculty. Again, that must occur to where everybody gets it at least once within a 12-month period. Each campus also has to develop and implement a comprehensive program to prevent the unlawful possession, use, or distribution of illicit drugs or alcohol by students and employees. And when we say illicit drugs, these are illicit drugs as defined by federal law. So if your state, for example, has legalized marijuana, that may be a state law, but this is a federal act. So federal act still considers marijuana illegal. So marijuana falls as an illicit drug according to the Drug-Free Schools and Campuses Act. And then the last major component of this act is to prepare a biennial report on the effectiveness of your campus's alcohol and other drug programs, as well as looking at the consistency and the effectiveness of your policies, particularly as your policies regard enforcement of alcohol and other illicit drugs. One of the questions that often comes up is regarding the letter of the law and the spirit of the law. This act was actually written in the late 80s, and the culture and the period of the time greatly influenced the language that the act was codified under. And we know that since the late 80s, a lot has changed in terms of prevention science, in terms of prevention research, in terms of prevention effectiveness. And when we really look at the spirit of the law, it really establishes an expectation that what we do is based upon current research, evaluation, and best practices. And when we look at this particular act, the focus of the act is really on prevention. So when you look at your substance use program, you can have an extensive treatment approach. You can have intervention, but the focus of this act is really on prevention and on primary prevention. And when you look at a lot of the finding documents and find letters, they are looking at your primary prevention program and making sure that you are doing those things. So having a primary prevention program is very important. We see campuses focusing on treatment, and that is good and great, and I applaud those campuses. But it's really important for the purposes of this act to focus on prevention. One of the questions I often also get is, what does certification of the Drug-Free Schools and Campuses Act mean? And if you look at that manual that I referred to earlier, in it, it says, as a condition of receiving funds or any other form of financial assistance under any federal program, an IEG must certify that it's adopted and implemented a program to prevent the unlawful possession, use, or distribution of illicit drugs and alcohol by students and employees. So we have to certify that we are abiding by the drug-free schools. But still, what does that mean? When schools certify themselves for the Title IV financial aid agreements with the Department of Education, there's a series of paperwork that the president or the senior administrator of the university signs off on. And within those forms are a bunch of certificates. And one of those certificates basically says, we will abide by the Drug-Free Schools and Campuses Act. In addition to that paperwork, there's a lot of representations and certification paperwork and a lot of funding applications and proposals. So there may be some other federal grants that other folks on your campus are applying for, that basically others are agreeing, saying, yes, as a campus, we're going to be doing this, that you may not even be aware of. So there becomes a situation where those that are implementing the prevention programs and other substance use programs may not even be aware of that others are certifying and saying, yeah, we're doing these things. So I often say, again, become friends with the director of financial aid, become friends with the folks that are in research sponsored programs, external funded programs, and find out if these representations and certifications are being signed off on. So that way, once you complete your biennial review, once you have a copy of your drug and alcohol prevention program notice that is being disseminated, you can make sure copies of that documentation are sent to the appropriate folks. So if they get audited, they have copies to show proof that what they are representing and certifying as fact can actually be documented. One of the questions that I often get is, well, if we certify, do we have to send something to somebody? Outside of those representations and certifications, the only time that universities have ever uniformly had to send anything off to the Department of Ed was in the early 90s. And what you see on the screen is a copy, a copy of a document that was used. And I can provide this to Anthony and Logan. And I just happened to find this as I was cleaning files one day. Universities were asked to basically complete this form and send it to the Department of Ed in the fall of '90 to certify that they were complying with the drug-free schools. It's a great document. I encourage institutions to fill this out, use it as a cover page for their biennial review, just as a certification, and have senior level administrators sign off on it. It's a great way to get your biennial review in front of senior level administrators, so that way they at least thumb through it and look at it to see the good work that is being done on college campuses. As for presidential senior level administration, again, the senior level administrator usually signs off on that Title IV financial aid recertification. And my understanding from talking to financial aid folks is that that minimally happens every 5 years, or that usually happens when a new senior level administrator takes helm of their position. So that again happens as frequently as 5 years, or when you have a new administrator. So if you end up having a new senior level administrator, again, that may be another good opportunity to bring this page to them and the requirements of the act, give them copies of your past biennial review if they're available, and engage a conversation with them regarding this particular mandate. One of the questions that I often get is, once we have a biennial review report and a drug and alcohol prevention program notice, what do we do with it? And I think a lot of this stems from confusion with the Clary Act. With the Clary Act, we have to submit our numbers online. We have to submit our numbers in paper. We have to send them away every year. There's this thought that once we have our biennial review report, there is a place that we have to send it to, along with a copy of our policy notice. And with the drug-free schools, currently that is not the case. Unless we're being audited, or unless the Department of Ed specifically contacts your university and says to send it somewhere, you keep your documents on campus. I do have some recommendations for campuses. I would encourage you to send hard copies to your president's office, to your senior level administrator's office for signature or certification. If your senior level administrator or president is not willing or cooperative to do that, then I would find the next tier, maybe the vice president of student affairs, or your senior leader leading student affairs officer for signature or certification. I would also send copies to the Office of Financial Aid, your Clary compliance officer, your research and sponsored programs office, basically anyone that you can think of that might be asked for a copy as part of an audit, especially as it relates to those representations and certifications. You might also consider sending a copy to any office that anyone might go to request such an alcohol report. So if you have a health promotion office on campus that focuses mainly a lot on alcohol prevention, that might be a good place to go. If you have a counseling clinic, that might be a good place. A dean of students. You know, the places on your campus would be specific to your campus environment. Over the past few years, I've seen more and more campuses place their biennial review report, as well as their drug and alcohol prevention program notice, just online for free public access. So that may be something else that your campus should consider and look into. For those that are looking for models of biennial reviews and drug and alcohol prevention program notices, I would encourage you to go Google and look up those models. You may find some things that appeal to you and your campus, and might serve as some good models for your campus's documents, especially for those campuses that are new and have not developed any documents in a while. In terms of record keeping, I often get asked, how long do we have to keep things? Well, first of all, I would encourage you to look at your institutional record retention policies, particularly if you are a state university and have state university record retention policies. But federally, we are required to keep those documents for 3 years after the fiscal year in which the document was created. So for those of you that are creating documents currently, we're currently in fiscal year 24, so you would keep things through fiscal year 27. And the things that you might typically keep would be your drug and alcohol prevention program notice, or at least a copy of the text that you would send out if you're doing so electronically. If you have the prevention program certification, that document that I referenced that was sent out in 90, if you use a derivative of that document, results of your biennial review. So if you have a biennial review report, and then if you have any supplemental materials, for example, if you use a survey such as the course survey or the National College Health Assessment Survey, any internal data, anything like that, evaluation or assessment reports, anything that really kind of relates to Drug-Free Schools and Campuses Act biennial review, anything like that, you would keep that for at least 3 years. If you're local and institutional record policies do not dictate anything for a longer period. One of the other questions that I often get asked is what must be included in the prevention program notice? And this is probably one of the easier parts of the mandate, and it is pretty well spelled out. One of the things that I would say is that if it is less than a page, you're probably not meeting the requirements of the Act. One of the other things that I would say is that this is different than the Clary notice. A lot of campuses will confuse this with Clary and think that they're one and the same. They really are two different mandates, and there really are two different requirements in terms of the content that is supposed to be shared and disseminated to our campus communities. When we look at the content, there are really 5 areas: standards of conduct, applicable federal, state, local, and institutional sanctions, a description of short and long-term health risk related to substances that are commonly used and abused and misused on your campus, a list of prevention and treatment programs available to students, staff, and faculty on your campus, as well as a clear statement that your institution will impose disciplinary sanctions. When we look at the standards of conduct, these are standards that cover all students who are registered for one course for any type of unit, except for continuing ed. As higher ed evolves, this is posing more challenges for campuses. So some things that you have to think about. As higher ed has evolved, we have students that are now taking online courses, correspondence courses, courses that are not on campus, but those students are getting credit for their work. So how do your standards of conduct apply to the students that are no longer physically on your campus? Another item of consideration is how do your standards of conduct apply to all the high school students that are enrolled in dual credit courses that are getting course credit although they are taking college credit courses in their high school courses in their high schools, possibly hours away from your main campus. Also, with the number of students that are employed by institutions, it may be important to consider the duality between a student and a student employee, and how do your student standards of conduct also relate, align, or contradict with employee standards, particularly as they relate to substance use. It may also be important for you to think about on-campus activities and off-campus activities, and how as an institution you differentiate between an officially sponsored activity, a not officially sponsored activity? And is there any gray between the two where it may not technically be considered an official sponsored activity, but there are enough students present or enough student leaders present or enough faculty or advisors present that it could be considered an officially sponsored activity, that the standards of conduct might apply. Legal sections, this is an area that would add a great deal of content to your notice. And typically the recommendations and suggestions are that you include sanctions for your campus, as well as local, state, and federal. And again, this is going to differ from institution to institution. If you have a residential campus, the number of institutional sanctions may be far greater than a community college. A residential campus in a small rural town may have a good number of local ordinances that they wish to include in the document, compared to a community college that has a 9-county service catchment area. The community college is not going to include local ordinances from every community in that 9-county area. So it may be best served by including more state and federal laws and ordinances and policy violations. But it is important for the notice to talk about that if anyone violates the policies, that they may be subject to both the institutional sanctions as well as criminal sanctions off campus. One of the other sections is health risk, particularly with illicit drugs and the misuse of alcohol. A lot of times what I see when I look at drug and alcohol prevention program notices is that someone has created a list a long time ago, and that list of commonly used substances has not been changed or updated. This list implies what is being utilized and used on your campus. So if you have data that suggests what's being used, that's really what you should include in this list. I'll see lists of drugs from the late 90s that include a bunch of the commonly referred to date rape drugs from that era. If students aren't using those drugs on your campus, it may be wise to remove them from the list and really just look at the drugs that are commonly being used at that time. When you look at the descriptions of risk, you should probably include information regarding risk of dependence, possible short-term effects, long-term effects, as well as the effects of overdose. And again, when you look at the risk, many people just use kind of a shotgun approach, and many people don't alter the listing once it's created. When we look at the considerations, again, it implies that these are the drugs that students on your campus are using. And it kind of implies that you have collected data to determine what drugs exist on your campus. So I always encourage people to really look at that list and clean it up. And if there are substances that are not really being commonly or widely used, to kind of remove those from the list. When we look at the section on drug and alcohol programs, really, this is where you get to promote your continuum of care. The mandate, again, really focuses on prevention. So you want to include what prevention programs you typically offer and provide to your students. But you also want to include if you have opportunities for assessment and identification, intervention, treatment, rehab, reentry, as well as recovery. You want to include the services that you have on the entire continuum of care. Some campuses may not offer a full continuum of care, and this provides an opportunity for you to promote any relationships or any memorandums of understanding that you may have with local social service agencies in the community. So if your campus does not provide counseling on campus, but you have a relationship with an off-campus treatment provider, you may choose to put that information as a referral source in the document. Some campuses will have a different drug and alcohol prevention program notice that they use for students, and a different one that they use for staff and faculty. Some will have one document that gets sent out to everybody. This is another opportunity. If you have an employee assistance program, that information should probably be included in it if it's one document for everybody. If you have two separate documents, that information should probably be included in the document for employees, staff, and faculty. Again, a lot of different things based upon your institution. With disciplinary sanctions, including a clear statement that you will impose sanctions on students that are consistent with local, state, and federal law. And also a listing of and description of sanctions that your institution will impose. Different institutions have different philosophies. Some institutions will offer the worst case scenarios. Others will present a menu of options. Others will list those sanctions which are more consistently applied to students who violate particular violations. My preference is typically a menu of options, but offering those sanctions which are more consistently applied for different sanctions. When must the drug and alcohol prevention program be distributed, and who needs to receive it? A lot of people think that this notice only needs to be sent once a year. And when you look at the regulations, that's not really what the notice says. It says that everybody needs to receive it once within a 12-month period. So a lot of schools will have a large dissemination in the fall, typically before October 1st, which is the beginning of the federal fiscal year. What you see on the screen is from a program review finding that says the distribution plan must make provisions for providing the drug and alcohol prevention program disclosure annually to students, and it should also include faculty and staff who enroll at a date after the initial distribution, and for employees who are hired at different points throughout the year. So you can have your big dissemination in the fall, but you also need to have a mechanism to provide that notice to students who enroll in the spring, and students who enroll in intersession, and students who enroll in summer. And you need to have a mechanism to catch employees who end up starting work after that huge dissemination in the fall. So everybody has to receive it at least once within a 12-month time period. You can't just do it once and then catch everybody up the next go around. Everybody has to get it at least once within a 12-month period. It is to be in writing. It can be electronic, but everybody has to get it at least once in 12 months in writing. And it has to be an active dissemination. You can't just put it out on a table at an orientation event. You can't just put it online. You have to engage in an active distribution to let people know that it is available to them. It has to be intentional. It cannot be passive. Over time, the methodology that the Department of Ed has allowed has kind of evolved. So initially, the expectation was that it would be snail mailed, and that goes back to the 90s, and that kind of set the stage for the philosophy of what was acceptable and what was not acceptable. Up until recently, electronic distribution would be allowed via email, but you would have to include the entire document, which again could be pretty lengthy in the body of the email. And luckily that has changed a little bit, that now institutions, as a result of the Occidental College program review finding, you can go ahead and send an email to each mandatory recipient with a brief paragraph saying we're required to send this to you as a result of the Drug-Free Schools and Campuses Act. You can send a direct link to the document, and you can have the document online in a web page. But it has to be a specific email to each document. It can't be a general email that says, here's a list of all the policies that you need to read. This has made life a lot easier for campuses. What I typically tell campuses who wish to use the direct link in an email document, that they have documentation of the Occidental College ruling in the event that an auditor comes and questions it. Because if you look at that guide that was written in 2006, this will not be in that guide. And I'm not necessarily certain how up to speed all the auditors are with this Occidental College ruling. One of the questions that I often get is, how do we conduct a biennial review? Because this is one of the more open-ended areas of this mandate. There's some great guidance in that document that we have, but it's not as clear, it's not as specific, it's not as precise, it's not as cookbook as the Clery Act. When this act was originally written in the late 80s, there was a lot of consideration that the legislators gave to the uniqueness of every campus, and the legislators at the time wanted schools to have some leeway in determining how to conduct their biennial review, what to put in it, based upon each university and college's uniqueness. I do have some guidelines and some suggestions of what you might include, and we will get to that in a few slides. But the key thing to remember is that there are two areas that the Department of Ed says must be included in your biennial review. The first is to determine the effectiveness of your comprehensive program. So you need to look at your overall program and all of the different elements of your comprehensive program and ask the question, are they being effective at reducing alcohol misuse and illicit drug use? The second area is looking at your policies and saying, are our policies being effective at reducing alcohol misuse and illicit drug use? And are we consistently enforcing them? And are the sanctions that we are applying, are we applying those sanctions consistently across the board? So those are the really two big areas when you conduct your biennial review that you really need to be looking at and asking. But it's interesting because this mandate is so ambiguous and vague, the word program is never really defined. And that was intentional in the 80s. Guidance is really not given by what program is meant. Some institutions will believe that the Drug and Alcohol Prevention Program notice is the program. When we look at research, when we look at best practices, we know that typically program is comprehensive. It's more than educational programs, it's environmental strategies, it's policy, it's enforcement, it's community organizing, coalition building. We have built a science to determine what is truly effective when it comes to reducing alcohol misuse, illicit drug use, substance use on college campuses. And again, it's really best to look at best practices and the science of prevention. One, because it's best for our students. It's what makes them healthy. It is what makes them academically successful. It's also what helps reduce liability that our institutions may face. I always like to say a comprehensive program entails more than just educational and therapeutic interventions. It includes policy, sanctions, and environmental strategies. And when we look at the Drug and Alcohol Prevention Program Notice, and we look at what it asks us to include in our scope of care, again, there's a continuum of care from prevention, assessment, identification, intervention, treatment, rehab, reentry. So in addition to the different strategies, there is a continuum of care that we're also encouraged to look at and include in our comprehensive program. The Department of Ed, sorry, I got ahead of myself. Many times we would want to also look at some frameworks, and depending upon our professional backgrounds, there may be some professional frameworks within our disciplines that we may want to lean into. The Department of Education several years ago developed some principles of program effectiveness. It's interesting when you look at those principles, how they align with the Drug-Free Schools and Campuses Act. So you may be able to go Google that document and use that as a framework. In the olden days of FIPSI grants, then when the Department of Ed actually was giving money to schools to fund college substance abuse programming, there was an organization called the Network of Colleges and Universities Committed to the Elimination of Drug and Alcohol Abuse Standards. That is now a defunct organization, but they created a set of standards which really guided the development of a comprehensive substance use prevention program on college campuses. And I really liked those standards, and it talked about student assistance, enforcement, policy, community organizing, just to name a few of the standards. ACHA has standards of practice for health promotion, which can serve a good foundation. The NIAAA College Alcohol Intervention Matrix talks about effectiveness programming at the individual and environmental level. CAS has some standards for alcohol programs, health promotion, counseling, integrated programs. And then ACHA has been working on revising its Healthy Campus 2030 initiatives and really looking at effective programs. So any of these can serve as a strong foundation and might be valuable tools in helping you look at your biennial review in a different lens and determining what is effective and what's not effective. And you may actually be able to use multiple of these to strengthen your biennial review. Several years ago, the Department of Ed had some grant competitions, and through those competitions, they had some project findings that determined what they deem to be effective prevention. These, while outdated, really do provide a good foundation. So for those of you who want to dig a little bit deeper, I would encourage you to look into those documents. They're what you would expect, looking at coalition, evidence-based programs, the collection of evidence, assessment, evaluation, community organizing, just really good documents and firm foundations. And for those of you that may not have a lot of experience with program planning, program implementation, doing substance abuse prevention programming in higher ed, I would encourage you to look these up. They're really good primers, and I think you'll find the reads valuable. When we look at the biennial review and looking at your comprehensive programs, there are typically three areas that I would encourage you to look at. One would be all of your programs. And that's typically your educational programs, your social programs, your alternative programs, your recreational programs. Another area would be your interventions, your therapy, your case management. And then the other area would be your policies. When you do this, I would consider you to think about it as not intending to be a brag document, not intending to be a subjective review. A lot of times when I review biennial reviews, it tends to be just kind of an inventory. These are all the things that we've done. Look at how great we're doing. This is really intended to be a critical analysis. And if and where possible, you're really to collect some objective data. Everybody is a different phase when it comes to assessment. Start where you're at. If you have processed data and you only have utilization numbers, collect that data. But from that data, you're at least able to make some objective judgments about the quality of the program, what you're doing, if you're doing it well, if you could do it better. If you have some more advanced assessment and evaluation, you might be able to determine more program effectiveness, if it's actually working. Are you meeting your intended outcomes, to determine whether or not the program should stay, should it remain, can you fix it, can you make it better? That is really kind of the purpose of the biennial review. When we look at biennial reviews, again, looking at the comprehensive program, looking at evidence-based strategies, collecting data. If you're not collecting data on the behaviors of your students, using some surveys, that's always recommended. Looking at different programs, so not just looking at programs of students that may be violating alcohol policies or students that might be considered problematic or abusive. But even like looking at your non-drinkers and if your abstainers, how are you looking at their needs? Most biennial review processes usually create a strategic plan of action. The end of the biennial review should have a set of recommendations that should be tackled during the next 2 years. And if that is missing from your biennial review, that is really an area that you need to include and really work on after the report is done. The biennial review is really intended to be a strategic action plan, not something that you just put on a shelf and let there collect dust until someone comes to look at it through an audit or it's time to create the next biennial review. A lot of campuses have had success with a committee approach or a task force approach or a coalition approach, and use the biennial review as a method or a means to really advance the work of prevention on college campuses. When I look at a biennial review, there are areas that I would suggest, especially when you're looking at the report. I would include an introduction, a summary of the process, who's involved, when it began, a timeline, how materials were collected, how materials were assessed and evaluated, what were the goals from the previous biennial review, were those goals met? If they weren't met, what were some of the challenges and barriers? I would include a section on the drug and alcohol prevention program policy notification process, how it's disseminated, if it's reviewed, how that review is done, who's included in that review, if there were any changes, why those changes were made, what updates were made from the past version of the policy to the current version of the policy. And then include a section on data. So, if you're collecting survey data, what are the findings of that survey? What are some of the other data bits? So if you have Clary data, what are the findings of that? If you have data from your medical clinic, your counseling clinic, judicial data, housing data, data from athletics. Every campus is different, but you probably have a great number of data points that you can collect to help put together a jigsaw puzzle to get a picture of what alcohol and other drug use on your campus looks like. And then, a section on your programs, a section on your interventions. And are they successful? Are they not successful? And again, wherever your campus is and wherever your staff are, that's where you're at. So if all you have are process data and you have utilization numbers, you have satisfaction data, great, start with that. If you're more advanced and you have data on learning outcome assessment, you have behavioral assessment, you have outcome assessment, you have longer longitudinal data, fabulous. You may have different bits of data for different things, and that's okay too. But the feds, when they come in to look at the drug-free schools, they're looking more and more for assessment and evaluation data that is objective and analytical. They just don't want to see people sitting around a table with subjective analysis saying, oh, look at how great we're doing. They're wanting to see more and more data to show that what you're doing is actually making an impact and impacting your campus in a positive way. After you've taken all this data in context, what needs to happen is really kind of making a SWOT analysis and saying, these are the things that we're doing well. These are the things that are weaknesses. These are our opportunities. These are our threats. And then making some recommendations for the next 2 years and determining what as a campus should be prioritized and what should be worked on during the next 2 years. So that way, in 2 years, when you come up for the next biennial review, you can look back and say, here were our goals from 2 years ago. This is what we've worked on. This is what we've been successful. This is what we've not been successful on. And let's do the cycle over again. In many ways, it's very similar to an accreditation cycle that our institutions go through in order to get accreditation, except that this happens every 2 years, where many of our institutions may go through an accreditation cycle every 5 to 10 years. When we look at the mandate, there are some data bits that are required. So the number of disciplinary sanctions, referrals, incidents, many of these your judicial office should be able to have, your police office may be able to have. It's suggested that you keep the track of incidents of vandalism. That's really hard to do. I've not seen a lot of schools who have been successful with that. Number of students attending counseling or self-help groups. As long as it's an aggregate and it doesn't release personal information, that's usually easy to do, but sometimes counseling offices have a little bit of a reservation doing that, especially if the numbers are small. And then attitudes and perceptions, usually the easiest way of doing that is through surveys. Reviewing current AOD programs, we've talked about that. Program metrics, the number of times the program's delivered, number of students. And again, as I said earlier, they're beginning to look more and more at numbers and research methods. You'll see here on the slide that the University of South Alabama was required to determine the research methods and data analysis tools to determine their program and effectiveness. And that was part of their corrective action plan. And again, I'm hearing more and more from schools that are being audited and found in non-compliance that data analysis and evaluations becoming more and more desired and required. When it comes to policies, again, looking at how consistently they're enforced and how consistently they're sanctioned. Some of my colleagues have indicated to me that when they got audited, the Department of Ed actually recommended that they submit a chart that looked at each individual student's case and the particulars of each offense. And this is the best example that I can offer. So if you had a student, they wanted to know if the student was an athlete or not. And then they asked the campus to list the number of basic consequences and whether or not the student got the basic consequence. So if you look at this slide, you'll see I just made 10 students up and whether or not they got a fine, a paper, an educational class, or basics. And what the Department of Ed was trying to determine was, did the athletes get different sanctioning than the non-athletes? And in this made up data, you will see just by eyeballing it, they did. And again, this is made up data, but this is anecdotal from a colleague that got audited, and basically this was what they were asked to submit after the auditors had been on campus. And as I said, once you do everything with your programs and policies, it really kind of becomes a strategic planning document, a SWOT analysis. You figure out your strengths, weaknesses, opportunities, and you develop some conclusions and you make some recommendations. When must it be conducted? Every 2 years. There's not necessarily a clear, precise calendar. Clery has a clear, precise calendar. For us, there's not. Now, there are some recommendations that it's to be done every even year. And when we look at common practice, this would be an even year. It would need to be done by December 31st. And either you go by a fiscal year or you go by an academic year. But I've had some schools that do it in odd years. I've had other schools that don't use a fiscal year or a federal year. They will use an academic year. So what I typically tell people is that there's nothing that's written in stone that says when you must do it, but as long as you are consistent, that is what is more important than anything else. So the next slide just gives some examples of that. And the last...
Eric, before you go through the last one, I just want to acknowledge that we are at 3:00 and people may have meetings to get to, but I just want to let people know that we are recording this and we'll posting the recording within 3 days. We are going to let Eric finish.
Okay.
We won't be able to get through questions. We will be hosting a session in January with Eric going through some of those questions and other questions as well. So we will get to those questions eventually, but wanted to let people know the recording will be available within 3 business days. Sorry, Eric, go ahead.
No, that's fine. And this should probably take no more than 5 minutes for those that have the ability to stick around. And some of these things we've already talked about. Now it's just the similarities and differences between Clary and drug-free schools. So with drug-free schools, the date for the notice, there's no specific date, but it typically has to be delivered to everybody once every 12 months. With Clary, the notice has to be disseminated by October 1st. In terms of who gets the notice, with drug-free schools, it's every student who has gotten 1 credit or more for credit, and all faculty and staff and all prospective students, faculty and staff should have it made available. With Clary, it's all students, staff, faculty, prospective students, faculty, and staff. We talked about report submission. With the drug-free schools, it's only when it's requested. But with Clary, it's expected to be sent off physically as well as electronically. With educational programming, with drug-free schools, there are not any specific educational programs that are directed to be administered or applied. So an institution has free reign. With Clary, particularly with the VAWA components, there are specific programs and examples and types of programs that are expected to be delivered, such as bystander interventions, primary prevention programs, risk reduction programs, those types of things. In terms of evaluation and assessment, with drug-free schools, it is expected to be incorporated into the biennial review process. With Clary, the evaluation and assessment process is part of the numbers that are submitted to the Department of Ed, and compliance is strongly recommended. With certification, both of them are part of the Title IV financial aid agreement, so that is similar. Interestingly, the Clary Act requires a compliance coordinator. That is part of the act. At this point in time, it is not part of the language of the regulations for drug-free schools, but the Department of Ed has started verbally articulating that they strongly suggest that each institution indicate and name a position or an individual to be the drug-free school and Campus Act Coordinator. What they find is that campuses that don't have that named are more likely to have it fall in the cracks when people leave positions, move on, get promoted, that kind of thing. In terms of enforcement, traditionally, Clary has been enforced more stringently, has gotten a lot more attention, typically has higher fines, but we're seeing the Drug-Free Schools and Campuses Act, particularly since 2020, 2012, 2013, has gotten increased monitoring and enforcement, and is really becoming more a prevalent issue across campus. So again, those are some of the similarities and differences that we're seeing. So again, lots of information. Thank you for sticking with me for a few more minutes above the 3 o'clock. As Logan said, we'll reconvene in January, and we'll have Q&A at that point in time. And thank you for being here today. Can't hear you, Logan.
Sorry, too many mute buttons over here. So thank you so much, Eric. Thanks so much for sticking around and sharing that and getting through all of that. Thanks so much for sticking around. That date is going to be January the 10th at 2 p.m. Eastern time. We will be sending out information about that, but we will be, it's our water cooler chat time, but we're going to be talking about the Drug-Free Schools and Campus Acts at that time. So thank you so much. As a reminder, the recording will be posted on our website within 3 days. Hope you all have a terrific rest of your day, of your week, and now we can unfortunately say a rest of your year. Thank you for all the things this year and hope to see you soon. Take care.
Very well. Thank you all.